The community have given me a purpose. You know, I know exactly what I want to fight for.
I was born in this area. I was born at Northern General Hospital. I lived all my life in this area until I got married. What happens in this community is part of me, because my father was the chair of the local mosque, and there was a lot of community members knocking on our door, so I've got it within me. It's deep within me.
Between the two sides of the city, there's a 10-year life expectancy difference between the sort of richer parts of the city and the poorer parts of the city. So I think that's a motivator for me, that actually I think that's appalling that we live in a city that has that level of inequality. We need to improve this area, improve people's lives in this area to close that gap.
I came to the UK at the age of 9. There was only 2 or 3 of us in the whole Yemeni community, which was about 10,000 steelworkers at the time, that could speak English. So everybody would come in with their phones. Abdul, can you help us? Abdul, can you? I was only a child.
We are a bridge, to be honest, between authorities and communities and young people.
I love to deal with people's problems and help them resolve them. I love to see people's mental health improve. I like to see people's careers develop.
The community have to have the biggest buy-in, because it's their lives we're trying to change, it's their lives that we're trying to make better.
Essentially, it's a programme of work which is being led by 4 key voluntary sector organisations across a part of the North East of the city. It's about how do we create happy, healthy communities. The first stage of that has been doing a large consultation with the community, and the results of that will help us to inform and develop community-based health plans.
This opportunity has brought a number of organisations together in a way that nobody else has been able to do so over, 3 decades. This model is something that's going to change so many lives and so many communities.
We had to trust this new idea that is coming. Trust has always been, whether it's this work or another work, it is it's the glue, really. There's no magic portion that is here. It's trust, and trust equals time and equals results.
The best way to reduce inequalities in health is by making sure that people are better represented. We and the system can form an integrated service for the clients. Usually the clients that they're not able to see, they're not able to reach, but we can reach them.
This is us as a group of people coming together with our residents to change North East for the better. This is us in our daily lives, and this is us what we do, and it's kind of like just simple.
I think people have always got something to give, and having that belief in people that they've always got something to give, that they might not realise what that is yet, and helping them to kind of explore that, I think, is a key thing.
I like the community to think of themselves, to think of me as a shortcut to bypass so much blockage in the system that is being created around them. You know, and we are no more than vessels in this system. The power is within the community.
I think in the coming years, you'll see less people going to hospital. I think you'll see more people being treated, whether it's in our gym, whether it's in our social cafe, whether it's in our community school, whether it's through the food pharmacy. All these areas are all moving towards helping people to feel well and feel happier and feel part of Sheffield, part of a community, and participate, be an active citizen. And if we can achieve that with the NHS, I think there'll be a lot of pluses for all of us in the future.